What we are is a specialist service, a non-operative specialist service, so we can take a lot of the workload away from the GP, who's maybe not sure what the best option is for this patient, but rather than send them directly to secondary care, they can come and see us and we can discuss options with them, give them a diagnosis and a prognosis for their condition. I would obviously discuss, following an assessment with the patient, the various options of treatment that they have for their particular condition, and discuss that with them and come up with a plan of what they would like to have treatment wise and where as well. So I've got advanced practice skills, which are the guided injections which we can provide in this service, instead of them having to go and have that done at the hospital, which a lot of patients are happy that they don't have to do that. We can do it locality based, so we're doing it here in the community, and again they tend to like that.
So I'm here to advise the musculoskeletal medicine team. So we have team meetings every Tuesday morning, meet with the consultant musculoskeletal physiotherapist and also the consultant orthopaedic surgeon within the service. And we have our extended school practitioners in those meetings as well. So cases are brought every week to discuss complex cases, and I'm able to provide the medical insight to that, whether that's discussing about medical and drug interactions, or whether they need advice on how their other medical conditions might impact on their musculoskeletal issues. And having this service means that there's not just an option of just physiotherapy or sending to orthopaedics. There's a big gap in between those two. So the orthopaedic service at the local hospitals also can provide operative interventions for things, but for the non-operative techniques and non-operative assessments and diagnoses, that big gap in between can be provided here in the service.
So my role is to see patients, mainly more complex patients that require more orthopaedic input, and also give my expertise to the staff so they can understand a little bit more about orthopaedic surgery and how that might affect the patients. And the vast majority of them don't actually require surgical intervention. So those that do can then go on to their secondary care provider, have a shortened waiting time so it's more efficient and more effective for the patient. They can also have a longer consultation with the clinician there and a shorter waiting time then to actually get the surgery that they need. So what we're doing is offloading that secondary care service. And for those patients who don't require surgery, we can give them very good care, very effective and efficient care here within the service.
I was having a lot of pain in my thumb, particularly my right thumb, to the point where I couldn't lift anything, and my range of movement was severely lacking. And came to see Burgess and went for an X-ray just to confirm that it was arthritis, and indeed it was. And then when that came back, I got the appointment to have a cortisone injection under ultrasound, which was amazing. It was absolutely brilliant. It 10 out of 10 for me.
Would you recommend it to your friends and family?
Absolutely, thumbs up.